First, we will hear from Dr. Jan Losby, the branch chief for the Health Systems and Research Branch in the Division of Overdose Prevention at the Centers for Disease Control and Prevention. Dr. Losby is responsible for evaluating and advancing the implementation of CDC's guideline for prescribing opioids for chronic pain and building scientific evidence to support state, community, and tribal efforts to address the opioid overdose epidemic. We're so grateful she is with us today to share CDC's comprehensive overdose prevention efforts.
Thanks so much, Catherine. It is an honor and privilege to be with you and to serve on this panel. In our time together, I will discuss the drug overdose burden, trends over time, and its evolving nature. Next slide, please. I will then walk through key aspects of CDC's prevention and our portfolio related to data, prevention, collaboration between public health and public safety, and community efforts. Lastly, I will share some relevant resources. So let's look at the next 8 slides that describe the evolving nature of drug overdose in the United States. Next slide, please. You've already seen this slide, so I'll just highlight a couple of points here, that it can be helpful when trying to understand the opioid overdose epidemic to think of it as 3 overlapping and reinforcing waves. Beginning in 1999 with prescription opioids, this increased, as you see here in the purple line, the heroin surge beginning in 2010, seen in the orange line, and largely the illicitly manufactured fentanyl, or IMF, and fentanyl analogs skyrocketing in 2013, the black line. Next slide, please. And opioids are now nested in a broadening polydrug crisis driven by stimulants such as cocaine and methamphetamines. From 2013 to 2019, the cocaine-involved death rate tripled, the red line, and the death rate for psychostimulants quadrupled, the green line. Opioids were involved in over 70% of cocaine-involved deaths and 50% of psychostimulant-involved deaths. Next slide. And looking holistically at all drugs involved in overdose deaths in the first 6 months of 2018, for 25 states reporting data to CDC, 2/3 of all opioid deaths highlighted by the arrow involve fentanyl. Also, 1/3 of deaths only involve fentanyl with no other illicit opioids on board. Next slide, please. In the same study using 2018 data, we reported that 63% of all opioid deaths involve some combination of cocaine, benzodiazepines, or methamphetamine. Next slide. How has polysubstance use changed over time? Using a national study of people entering treatment of opioid use disorder, researchers found that past month illicit opioid use increased from about 45% in 2011 to 70% in 2018. At the same time, the use of prescription opioids remained high but decreased slightly from 95% to 85%. And the use of prescription opioids alone dropped from 55% to 30%. As shown on this graph, past month use of at least one non-opioid drug occurred in nearly all participants, over 90%, with significant increases in methamphetamine. Next slide, please. CDC released a health alert network last December, and in it we looked at provisional estimates in drug overdose deaths from the 12 months ending in May 2020, revealing a concerning acceleration of drug overdose deaths during the COVID pandemic. Here, there are many potential reasons for these trends that we are seeing, including persons struggling to maintain access to essential harm reduction, treatment, and recovery support services, initiating or increasing substance use to cope with the stressors and social isolation created, and using illicit drugs while alone more frequently. Next slide, please. On the left, this map shows the percentage change in the 12-month provisional count of all fatal overdoses from June 2019 to May 2020. With red indicating greater increases, drug overdose deaths during this time increased more than 20% in 25 states, including D.C. The map on the right, we see the percentage change of fatal overdoses involving synthetic opioids, the dark burgundy showing increases of 50% or more. Of the 38 jurisdictions with available synthetic opioid data, 37 jurisdictions reported increases in synthetic opioid overdose deaths, 18 reporting increases greater than 50%, and 11% reporting increases 25 to 49%. Next slide, please. If we turn to CDC's efforts related to data and surveillance and prevention. Next slide. The Division of Overdose Prevention has its goal and vision and mission of ending drug overdose and related harms with a specific mission to monitor, prevent, reduce harms associated with drug use, misuse, and overdose. Within the division, we have 6 key strategies that address these overarching goals, mission, and vision. And I'll touch on some of these during the remainder of my time with you. Next slide, please. CDC is funding 66 jurisdictions, including states, territories, cities, and counties, who are part of the Overdose Data to Action program. The program combines data and prevention efforts. The seamless integration of data informing action is essential because of the potency and the rapidly shifting illicit drug market. And I'll give some examples of the work here. Next slide, please. Data guide what we do, where we do it, and allow us to know if our actions are making a difference. We need more timely, high-quality, comprehensive, localized, and actionable data. And we need to create data that are easily accessible and readily used. We do this both for morbidity and mortality data. For morbidity or non-fatal overdoses, we leverage existing data systems such as syndromic data within 24 to 48 hours and hospital billing and claims data, sometimes within 3 to 4 weeks. This allows us to report drug overdose emergency department visits as quickly as every 2 weeks. Now a total of 75% of emergency department-related drug overdoses are captured. Next slide, please. Through OD2A, states are incentivized to share data quarterly with deaths that occurred 6 to 11 months ago. Detailed information about deaths and their circumstances from death certificates, medical examiner and coroner reports, and toxicology results. Next slide, please. More detailed data can help us inform future prevention activities or help us refine current prevention activities. Data allow us to know not only that someone died from a drug overdose, but also the details about all drugs at the time of death and the route of administration. It also tells us the circumstances leading up to an overdose, such as someone's prescription and substance use history, if they were in recovery or had a relapse, if they were recently incarcerated, or if they had any co-occurring mental health diagnoses. Next slide, please. OD2A also encompasses a range of prevention strategies, and I'll just note a few here. So better use of prescription drug monitoring program, or PDMP data, to inform prescribing practices and prevention interventions, supporting healthcare providers and health systems with drug overdose prevention and response, including expanding the use of evidence-based prescribing and treatment practices. Related to linkage to care, ensuring people are connected to the care they need by leveraging systems and upstream prevention efforts. Improving state and local prevention efforts to build more effective and sustainable surveillance and implement community-level interventions in high-burden areas. Next slide, please. CDC is also funding tribes to address drug overdose. We are funding 11 tribal epicenters and those that you see listed on this slide to provide technical support to tribes and key partners for data collection, use, and for sharing. Equally important, we are funding 15 tribes from across the country to implement prevention and response activities like that, similar to those I outlined earlier, supported in OD2A. Next slide, please. I'd like to highlight a few public health and public safety collaborations. Next slide. One of the ways CDC is broadening our work is by strengthening the partnership between public health and public safety. One program involves CDC's collaboration with high-intensity drug trafficking areas, or HIDAs, in 30 states around the Overdose Response Strategy, or ORS. We support both a public health analyst and a drug intelligence officer in each of these HIDAs in the light blue states on the slide, and a DIO in the dark blue states. The program works to coordinate data sharing between public health and law enforcement, developing and supporting the implementation of evidence-based programs, and strengthening engagement of local communities to promote the inclusion of those most impacted by the drug crisis when designing, planning, and implementing activities. Next slide. CDC is co-sponsoring with the University of Baltimore and ONDCP to combat opioid overdose through community-level intervention initiatives. These are innovative, evidence-based community interventions, and I've listed a few examples here. So, for example, emergency department-initiated referrals to MOUD, on-call recovery coaches and referral to treatment for opioid use disorder in fire departments, expanding access to medication opioid use disorder, MOUD, in jails, and all of these have the goal of moving forward to expand reach and scale. Next slide, please. With funding from Bloomberg Philanthropies and in collaboration with the CDC Foundation and NIHCCM, CDC developed a toolkit to guide localities in initiating and maintaining partnerships to reduce overdose deaths. The guide and this toolkit that's listed here illustrate information to help target response efforts through accountability, collaborative, and coordinated teams. The org chart, which I know is quite small here, shows the makeup of these FAST teams. And as you can see, the teams are inherently multi-sectoral and community-based. The teams focus on collaboration and learning, coordinated response activities, as well as continuous quality improvement for the purpose of reducing overdose deaths. Next slide, please. If we transition and look at the efforts that are happening at the community level, next slide, please. Implementing overdose prevention strategies at the local level is a cooperative agreement between CDC and NIHCCM that began in 2019. The program was designed to mirror OD2A that I mentioned a little bit earlier in local communities by providing funding to conduct overdose surveillance, prevention, and response work. This is a comprehensive, interdisciplinary, and integrated public health approach. You can see here the sites that were funded in round 1 and round 2. Next slide, please. Beginning in 2020, CDC is collaborating with ONDCP to administer the program, working closely with CADCA to support it. And this is the Drug-Free Communities Program. The central aim of the Drug-Free Communities Program, or DFC, is to use community-based coalitions across the many different sectors shown on the slide to organize, to prevent substance use. The DFC program includes a community match requirement to further enrich commitment and buy-in, and a community can be funded for up to 10 years. It was launched in 1998 and has grown substantially. There are over 700 coalitions last fiscal year, and right now 1 in 5 Americans now live in a DFC community. Next slide, please. I wish to close by sharing a few resources that might be relevant to your work. Next slide. On the left, CDC developed an evidence-based menu and published a summary report on 10 best practices. This is based on the efforts happening in communities that I've highlighted earlier. It includes detailed explanations of harm reduction strategies such as targeted naloxone distribution, Good Samaritan laws, syringe services programs, MOUD and criminal justice settings, and emergency department buprenorphine initiation. On the right, this is, I pulled this earlier from the earlier slide, just to have it here as a resource. So this is the one that guides partners in their use of information to target response efforts through collaborative and coordinated team efforts with the goal of reducing drug overdose deaths. Next slide, please. In 2017, we launched the RX Awareness Campaign, and this was the first ever federal health effort to raise awareness about the dangers of prescription opioids. And the campaign tells the stories of real people whose lives were affected by prescription opioids. In July of 2020, we launched some additional stories featuring audiences heavily impacted, including pregnant women, veterans, younger adults, older adults, and American Indian Alaska Natives. The new campaign messages evolved in a more positive, empowering, and hopeful approach, emphasizing that recovery is possible and emphasizing that where there is hope, that recovery is possible. Next slide, please. Resources for providers. Many of you are probably familiar with these, so I just included the link to the interactive trainings on the topic of communicating with patients and dosing and titration and assessing and addressing SUD. And many of the interactive trainings are really tied to the CDC's prescribing guideline that was released in March of 2016. These two additional resources, one looks at quality improvements and the other provides advice and insights from healthcare and executives. I will close here. I think we'll have time for some questions at the end, but just in terms of where do we go from here on the next slide, you know, continuing prevention efforts at the state and community level, continuing to address areas around the evolving drug trends that we're seeing. Now with IMF and other illicit opioids, it requires enhanced coordination and collaboration. It also is important to expand access to and training for administering naloxone, which is essential, including those who are knowingly using opioids, their friends and others, or who are responding to an overdose, expanding the provision of overdose prevention education, and I'll just note here in reference to time, expanding access to and the provision of treatment for substance use disorder and addressing barriers such as stigma. So Catherine, I will turn it back over to you. Thank you so very much.
Thank you so much, Jan, for the CDC's leadership and data collection that informs action and your support for partnerships with the states and local communities to foster evidence-based strategies and solutions.